So, hi everyone, I'm Ayanshali Pasqua, and today I'll be talking about a very important topic in maternal health, which is the spontaneous abortion. So, I'll be discussing an important and sometimes sensitive topic, which is the abortion and the different types of abortion. So first is what is abortion. So abortion is defined as the termination or loss of pregnancy before the fetus reaches viability. So typically before the 20th week of gestation. It can happen spontaneously due to natural causes, it can be induced or either for medical or personal reasons. Understanding the different types of abortion is essential for us future nurses because each type requires a specific kind of assessment, care, and emotional support. So in this, I'll walk you through the main types of abortion, their causes, signs, and symptoms, and the nursing interventions involved. So let's begin. Spontaneous abortion, also known as miscarriage, is the natural loss of pregnancy before the 28th week of gestation. So this happens without any medical or surgical intervention. It's different from an induced abortion, which is done intentionally. Spontaneous abortion is actually the most common complication in early pregnancy. In the first trimester, the most common cause is fetal genetic abnormalities. So this means the baby development wasn't normal at the chromosome level. While in the second trimester, it's more likely related to maternal conditions like infections, chronic disease, or problem with the uterus or cervix. So in nursing assessments, as nurses, we play a big role in identifying and responding to spontaneous abortion. If a patient presents with symptoms, the main sign to watch is for vaginal bleeding. Here what we should assess. Ask the patient about the color of the blood. If it's bright red, that could be a serious sign. About the amount, if she's soaking a pad per hour, that's significant. Check if there's any clot or tissue pass and ask if she's experiencing pain, cramping, or contractions. Also, always take vital signs to monitor for shock or instability. And lastly, assess the patient's emotional state and understanding of what's happening. So, this experience can be physically and emotionally painful. As future nurses, we must not only provide clinical care but also emotional support. It is important to be gentle, reassuring, and help the patient understand what's going on. We must also explain the plan of care and offer resources if needed, like grief, support, or counseling. In some cases, a spontaneous abortion may resolve on its own, but there's retained tissue or signs of infection, the patient may need further medical or surgical treatment. I hope this gives you a clearer understanding of spontaneous abortion and our role as nurses in managing it.
So misabortion. A misabortion happens when the baby embryo or fetus has died, but the body does not expel the pregnancy during a tissue right away. It is usually found during a checkup or ultrasound. It is often discovered during an ultrasound when the doctor finds no heartbeat or sees the baby has stopped growing. So there are some causes of misabortion. The first one is, of course, the genetic abnormalities in the baby. The second one is the hormonal problems like low progesterone. The third one is infections, of course, chronic diseases like diabetes or thyroid problems of the mother. Also, the abnormalities in the fetus, unknown causes, sometimes it just happen naturally. So there are signs and symptoms of incomplete abortion. The first one is heavy vaginal bleeding, but it's more than a normal period. Severe lower abnormal cramps or pain, passing tissue or clots from the vagina, fever or chills, of course, if infection starts, foul smelling in a vaginal discharge, So there are also interventions and management for this incomplete abortion. The first one is medical treatment. Misoprostol may be used to help expel the remaining tissue. Antibiotics if infection is suspected. The second is the surgical treatment. Dilation and curettage, or what we call DNC, or manual vacuum aspiration to clean the uterus. The third one is monitoring. The first, we will check the vital signs, especially the pulse, blood pressure or temperature. We will also monitor bleeding and pain. Ultrasound to confirm uterus is empty. The next one is supportive care. Emotional support and counseling. IV fluids if bleeding is heavy. Of course, rest and recover at home after treatment. We will also take note that incomplete abortion is a medical emergency. If not treated, it can lead to serious infection or severe blood loss, or it can lead to death. So the next one is an incomplete abortion. An incomplete abortion happens when some part of pregnancy, like placenta or fetal tissue, remain inside the uterus after a miscarriage or an induced abortion. It can lead to a bleeding, infection, and pain if not treated properly. So there are causes of incomplete abortion. The first one is spontaneous miscarriage. It is natural pregnancy loss. The second one is unsafe or unskilled abortion procedure. Third one is use of abortion pills without follow-up checkup. The next one is the uterine abnormalities or infections during pregnancy.
The next type of abortion is inevitable abortion, a pregnancy loss that is unavoidable. The cervix here has begun to dilate and bleeding is present. Some signs and symptoms would be vaginal bleeding, cramping, backache, and the passage of tissue or clots. Causes can include chromosomal abnormalities, infections, hormonal imbalances, and severe maternal health issues like uncontrolled diabetes or hypertension. Here are some medical managements like monitoring the process, some pain management, potentially dilatation and curettage to remove any remaining placental tissue to prevent infection. Then we have complete abortion. It is when all the products of conception have been expelled from the uterus. Signs and symptoms are vaginal bleeding that may initially be heavy but then decreases. Passage of fetal tissue and placenta, often cramping that may be severe initially but subsides as the tissue is expelled. Causes can be similar to inevitable abortion like infections and chromosomal or uterine abnormalities. Interventions of complete abortion typically resolve on its own. A pelvic exam is crucial to confirm the complete expulsion of all products of conception. A blood test is also done to measure HCG levels to confirm the pregnancy has ended. In some cases, a follow-up ultrasound may be recommended.
So we're going to talk about threatened abortion. A threatened abortion or threatened miscarriage is a vaginal bleeding during early pregnancy like 20 weeks with a closed cervix and a detectable fetal heartbeat. It doesn't automatically mean miscarriage will occur. Many pregnancies with threatened abortion continue to term. It signifies the potential risk of miscarriage during monitoring and potential intervention. So on the next slide, we're going to talk about the causes of threatened abortion, like first, the chromosomal abnormalities. The most common cause often undetectable. Next, the maternal factors like infection, hormonal imbalance, obesity, smoking, substance abuse. And the third one is the trauma, physical injury in the abdomen. And lastly is, in many cases, unknown causes remain unknown. So the next slide is we're going to talk about the signs and symptoms. First, vaginal bleeding can range from spotting to heavy bleeding. Abdominal cramping or pain can be mild to severe. Backache, lower back pain may also present. So, on the next slide, we're going to show you the confirming diagnosis. First is the pelvic exam to assess cervical dilatation and uterine tenderness. Next, ultrasound to visualize the gestational sac, embryo, and the fetal heartbeat. Assess for subchorionic hematoma. And lastly, the blood test to measure HCG level and check for infection. So, that's all for the threatened abortion. So, the last slide for threatened abortion is the management. Close monitoring, rest, and avoidance of strenuous activity. Progesterone supplementation may be prescribed in some cases, but evidence of effectiveness is mixed. ROH, immune globulin, for Rh negative mothers to prevent sensitization.